Hello and welcome. Today we'll be discussing neurogenic bladder, a complex condition affecting the urinary system. We'll explore its causes, how it affects the body, its symptoms, diagnosis, treatment options, and more. Join us as we delve into understanding this important condition. Neurogenic bladder isn't a single disease, but rather a condition resulting from a neurological problem. This means that the nerves controlling the bladder and its associated muscles are damaged or malfunctioning. Causes range from spinal cord injuries, stroke, and multiple sclerosis to Parkinson's disease, diabetes, and even certain birth defects like spina bifida. Essentially, anything that interrupts the communication pathway between the brain and the bladder can lead to neurogenic bladder. Normally, the bladder fills with urine, and nerves signal the brain when it's time to empty. The brain then sends signals back to the bladder muscles to contract and the sphincter muscles to relax, allowing urine to flow out. In neurogenic bladder, this coordinated process is disrupted. Depending on the specific nerve damage, the bladder might not fill properly, it may not empty completely, or it might empty involuntarily. This can lead to a variety of problems, including urinary retention, incontinence, and increased risk of urinary tract infections. Unfortunately, precise epidemiological data on neurogenic bladder is challenging to gather because it's often a secondary condition stemming from other underlying neurological disorders. However, we know that the incidence is directly related to the prevalence of conditions like spinal cord injuries, stroke, and multiple sclerosis. Therefore, regions with higher rates of these neurological conditions will likely see a corresponding increase in neurogenic bladder cases. It affects people of all ages, from newborns with congenital conditions to the elderly who are more prone to stroke and neurodegenerative diseases. The signs and symptoms of neurogenic bladder can vary greatly depending on the type and severity of the nerve damage. Some common symptoms include frequent urination, urinary urgency, difficulty starting urination, a weak or interrupted urine stream, feeling like the bladder isn't completely empty, leaking urine, incontinence, frequent urinary tract infections, and even bladder or kidney stones. In some cases, individuals may experience no symptoms at all until complications arise. Diagnosing neurogenic bladder involves a comprehensive evaluation. This typically starts with a detailed medical history and physical examination. Further testing may include a post-void residual urine test to measure the amount of urine left in the bladder after urination, urodynamic testing to assess bladder function and pressure, cystoscopy to visualize the inside of the bladder and urethra, and imaging studies like X-rays or ultrasounds to evaluate the kidneys and bladder structure. Neurological evaluations may also be performed to determine the extent and location of nerve damage. Neurogenic bladder can be broadly classified into two main types: spastic or overactive bladder and flaccid or underactive bladder. Spastic bladder is characterized by involuntary bladder contractions, leading to frequent and urgent urination. Flaccid bladder, on the other hand, involves a bladder that doesn't contract strongly enough to empty completely, leading to urinary retention. Understanding which type is present is crucial for guiding treatment strategies. Treatment for neurogenic bladder aims to manage symptoms, prevent complications, and improve quality of life. This often involves a multifaceted approach. Intermittent catheterization is a common method for emptying the bladder regularly. Medications, such as anticholinergics, can help relax the bladder muscles and reduce urgency and frequency. In some cases, surgery may be necessary to improve bladder emptying or reduce incontinence. Other options include Botox injections into the bladder muscle, nerve stimulation therapies, and reconstructive surgery in severe cases. Regular monitoring for urinary tract infections is also crucial. While it's not always possible to prevent neurogenic bladder, particularly when it's caused by congenital conditions or traumatic injuries, managing underlying health conditions like diabetes and multiple sclerosis can help reduce the risk. Practicing good bladder habits, such as emptying the bladder regularly, can also be beneficial. Prompt treatment of urinary tract infections can help prevent complications. For individuals at high risk, regular monitoring and early intervention can help minimize the impact of the condition. The prognosis for individuals with neurogenic bladder varies depending on the underlying cause, the severity of nerve damage, and the effectiveness of treatment. With proper management, many individuals can maintain a good quality of life and prevent serious complications. Recent research is focused on developing new and improved therapies, including advanced nerve stimulation techniques, regenerative medicine approaches, and more targeted medications. These advancements offer hope for improved outcomes and a better future for those living with neurogenic bladder.